I'll just introduce myself. Hi, I'm Wendy Craig, for those of you who don't know me, and I'm the scientific co-director of PREVNet. And on behalf of our team, I'd like to welcome you to our webinar today. I'd like to start off by just asking you, wherever you're located, to join us in acknowledging and thanking the generations of Indigenous people who have cared for the lands and celebrating their continued strength and spirit. PREVNet and myself are located at Queen's University, and we're situated on the Anishinaabe and Haudenosaunee territory. I'm a fourth generation white settler, and I'm grateful to have had the opportunity to meet, work, learn, and play on these lands. And our work at PREVNet is dedicated to working towards addressing the systemic racism and the impacts of colonization that put people at greater risk of violence. So I want to thank you for joining us, and we're bringing today's webinar from our community of practice that addresses teen dating violence, and it's funded by the Public Health Agency of Canada. Before I introduce the speaker today, I'm going to do the background rules and information and go through the format. So we posted a link in the chat, and you can find the slides in English. And you can make it so that will help you follow along if you wish. Today's webinar is going to run for about 75 minutes. We'd like the webinar to meet your needs and be as interactive as possible. So if you have questions along the way, put them in the chat box or save them till the end, and we'll have an opportunity at the end to have a great question and answer and discussion period. Also, at the end of the webinar, you'll see a link to an evaluation of today's webinar. Those evaluations are really important to us at PREVNet, and they provide us good information about what kinds of webinars we should be planning and how we should be doing them. All of your feedback is anonymous, and we'd be grateful if you take the 2 minutes to complete it. And then also, once you've completed that, you'll be directed to a website that will prompt you to enter your full email address, and that will get you your certificate of attendance. Just to let you know, the evaluation and the certificate of attendance are completely separate, so you can be as honest as you want, and you'll still get a nice certificate. And then the last piece I want everybody to know is that we are recording today's session, and we'll send out that link so that you can share the recording or listen to it again, because it's going to be so rich with information. So that's all I have to say on the administrative front, and now it's my great pleasure to introduce our speaker today, Dr. Tracy Vaillancourt. And I was thinking about what I wanted to say because I've known Tracy for over 20 years. I couldn't get down to the moment, but I remember some very early moments, and I'm not going to talk about those, no. But I just want to say that it's truly a pleasure. I have to say she's one of the brightest people that I know. And she's probably one of the most accomplished researchers in the world, and who does her research on bullying and mental health and leads the world with her originality and her novel ideas. She's very committed to ensuring that research gets translated into practice and programs and policies, and has been a leader in Canada, particularly about school and mental health and COVID issues. As well as all of her bullying work. And so I think she's really demonstrated unparalleled leadership in her research program and in bringing people together to collaborate on science. And most importantly, one of the things that I love about Tracy is that she is passionate in everything she does. She'll tell you how it is, and she'll be really clear on what we need to do. And I have to say, she is truly making a difference for Canadian children and youth. Now the official part of that was my add-on, that she's a Tier 1 Canada Research Chair in School-Based Mental Health and Violence Prevention at the University of Ottawa. And she's cross-appointed as a full professor in counseling psychology in the Faculty of Education and School Psychology. I have to hurry, I have construction in my house. She's a core member of the Brain and Mind Institute, the Faculty of Medicine and the Center for Health Law, Policy and Ethics, the Faculty of Law at the University of Ottawa, and she is the president-elect of the International Society for Research on Aggression. And most recently and most deserved, she became a fellow of the Royal Society of Canada, which recognizes Canada's top scientists, which she truly leads and is extraordinarily talented to have that designation. So I'm delighted to have Tracy with us today, and I'm going to put on my mute so you don't have to listen to the construction and you can focus on her very powerful words. So thanks, Tracy.
Thank you, Wendy. I really appreciate that lovely introduction. One thing I probably should have planned was the link for the Royal Society of Canada's report on children in schools. And Stacy, if you by any chance have a second and you can Google and find it and just put in the link for the PDF, that'd be great. And if not, then I could just make sure that everybody gets it at the end. But basically what I'm going to be presenting today is going to be a lot of material coming from this comprehensive report that was just published in August. It's available in French and in English. So I think it's a really good resource for those of you who are interested in children and youth like I am, and I imagine if you're on this webinar, you are. So hopefully we'll get that link up, and if not, I'll make sure it gets sent. Okay, so let's see here. So basically what I'm going to do today is just outline where we were and where we are, and some strategies that I hope will help ameliorate the mental health of children and youth in Canada. I'm happy to take questions. My preference would be just to take them at the end, but if there's something really burning and you wanted to address now, I'm happy to do so. And like Wendy said, we'll meet your needs. So we'll start where we were. So what did youth mental health look like before COVID-19? So when we talk about mental health, we talk about it along a continuum of well-being to emotional problems and concerns and mental illness. And so when we cross the line into mental illness, we're talking about a diagnosis. Most of the research is done on emotional problems and concerns, so symptoms. But once distress and or disability is present and the symptom count adds up, you have a mental disorder. So I'll be sure to specify when I'm talking about a mental disorder versus symptoms. A lot of children, though, live right on this margin. And what differentiates, again, those who come from that emotional problems and concerns over to mental illness and having a mental disorder is they can't get to school, they can't make their job, they're not functioning well in their family and the like. Children do not code switch out of a mental disorder, and this is a really important thing to keep in mind. It exists across a variety of contexts and is entrenched. So if a child is struggling in school, but not at home, not at their soccer practice, not in other contexts, it's not very likely going to be a mental disorder. It's going to be a problem with fit. So there's an incompatibility between the child's temperament and his or her environment. When we have a mental disorder, it exists at home, in the workplace, with our peers and the like. And some children fare better in one context than the other. Some children can mask their anxiety when they're with their peers, but are still suffering tremendously in silence. But I don't want us to think that this is something that just exists in one context. It exists across a variety of contexts. In terms of the scope of the problem in Canada, we have far too many children and youth who meet diagnostic criteria for a mental disorder. So between 15 and 22% of children in Canada meet diagnostic criteria for mental disorder. And we have over 20% also reporting experiencing 2 or more psychological symptoms per week. So we have a mental health crisis in Canada that predates the pandemic. It's interesting though, I follow the media very carefully, and it would seem that now we're paying attention to mental health, thinking that this just sprung up de nouveau when it was not the case. It's always been there. I've been studying children's mental health for the better part of 20 years, and we've had really high rates for a very long time. The latest Unicef report card tells us this as well. When we compare ourselves to 38 economically advanced countries, we're at the bottom. So we rank 30th out of 38 countries on all the indicators that they have. And on mental well-being, we rank 31st. So that's not acceptable to me, and I don't think it's acceptable to anybody else who's listening to this, which is why we wrote an op-ed. And I'm going to talk a lot about the op-eds that we wrote, because as Wendy said, I'm really interested in pushing the envelope in this area. I'm really interested in engaging policymakers and engaging our government into funding programs that we know work and will help children. So we penned this and called on Trudeau directly to invest in children's mental health. We also know that it's an issue that is not getting better. So if we look at the Unicef report cards across time, we see that we've consistently done poorly on children's mental health. What you see here is it's comparing the 2010 data and the 26 data to the current data. And our lines are not getting better. They're clustered around the same area because we haven't improved children's mental health. We have an enormous issue with respect to youth suicides in Canada. Generally speaking, suicides are the leading cause of death among youth in high-income countries. It accounts for almost 18% of all deaths. But in Canada, when you look at our rankings, we're near the bottom again, using the Unicef data. It's a particular problem for adolescent boys in Canada, and it's a particular problem for First Nation, Métis, and Inuit youth. So when we think about children's mental health and youth mental health, we also need to be thinking about suicide prevention. There's enormous continuity when it comes to mental health. 50 to 75% of mental health issues in adulthood began before the age of 15. So, being depressed at 14 puts you at risk of being depressed at 18, and that puts you at risk of being depressed at 28 and 38 and 88. So we really want to be attending to this early in people's lives so that we can derail this negative trajectory. And I'll just give you one example from a study that I did with my postdoc, Amanda. So what we did is we modeled the trajectories of social anxiety symptoms. So these aren't disorders yet, right? So these are just high symptoms. And we looked at this in over 700 kids in Canada that were assessed yearly from grade 5 to grade 12. And we're going to just contrast here the high symptom trajectory from the low symptom trajectory in the prediction of adult disorders from the age of 19 to 23. And what we found is that if kids followed this high trajectory of social anxiety symptoms across childhood to adolescence, they were 20 times more likely to be diagnosed with depression in adulthood, 16 times more likely to be diagnosed with social anxiety disorder, 16 times more likely to be diagnosed with agoraphobia, and 13 times more likely to be diagnosed with generalized anxiety disorder. Can you imagine if we juxtapose this onto a physical health issue? And I told you that if you had an elevated BMI at 14, and that made you 20 times more likely to have hypertension in early adulthood, what would be our response? Our response would be immediate. We would recognize this is a serious, serious crisis. And yet this has been going on forever without much address. Mental health issues are the leading cause of disability worldwide in adults. They account for 14.3% of deaths. So 8 million people die each year because of mental health problems. It is a huge issue. We know that the risk is not equally shared and that those who are disadvantaged are even more disadvantaged. It's always the case. So those that are at risk fall into, into problems in a variety of areas. In this respect, it's socioeconomic disadvantage that really places children and youth at risk for mental health problems. So this is a Canadian study. We found, not we, but Gunn found that 25 to 35% higher rates in children who came from low income families. And it makes sense to me. Poverty is an enormous stressor and it puts a burden on children that they do not deserve. We also know, as another example, that girls are more affected than boys. So girls are 2 times more likely to be depressed, 2 times more likely to be anxious. The only exceptions are with respect to externalizing problems in autism spectrum disorder. Now, one of the things that's emerging from the literature that I'm very interested in, and the students that work in my lab are very interested in, is the intolerance for discomfort that we're seeing. So there's a generation effect that we're seeing that is fairly new, where not only are children intolerant for discomfort, but so are their parents. And so their parents are so sensitive to their children's stress that they do everything to insulate them. And the problem with that approach is that it leads to more anxiety. So these are the parents who contact the coach to say that their daughter played 7 minutes less and that you destroyed their self-esteem. These are the parents who, if their child receives a B on an exam, calls the school immediately and wants it rectified. Now, I'm not saying that all parents do this, but we are seeing an increase of this type of intervention that has not been seen before. And the research is pretty clear on this, that being insulated from distress and discomfort increases anxiety in the future. And it leads to more severe symptoms, more impairment, and poorer treatment outcomes. So I'm not saying that we want kids to be stressed out. I'm not saying that we abuse kids or we, promote failure or anything of the like, but we need to get back to basics on resilience and stress management and the like, because we certainly do have an anxiety crisis in Canada. Now, this interacts with the presentation of symptoms when the parents are distressed about their child's discomfort and the child is distressed about their discomfort. And the reason it becomes problematic is because there's a lack of autonomy for kids. So youth are influenced by their environments more than adults. They don't make the decisions. They're not the ones who decide that now I'm at the clinical threshold and I should be seeing a clinician. It's typically the parents who are making that decision, or teachers are identifying this as being different from their peers and suggesting to parents that something be done. And as clinicians, you'll know this, and I know this as a former clinician, that it really can influence the way we see their symptoms and their impairment. So children are nested within families, and their families are complicated. And this is one thing that I'm going to highlight about what's happening during COVID, is that these stressors that parents are facing are not independent of what happens to their children. So keep in mind always that children are nested within their families, they're nested within their schools, they're nested within their communities, and they're more sensitive to these environments than adults are. In Canada, we have an enormous service gap, and this breaks my heart. We do not have enough clinicians to manage the issue. Most youth in Canada do not receive services, only 20%. And you can imagine the ones that do receive services are the ones who are bigger in their presentation, more obvious in their presentation. So children with behavioral disorders and ADHD are more likely to receive services. Those with severely impairing mental disorders are also more likely to receive services. The thing about mental health prevention is that it's actually fairly straightforward. If we can address this earlier before it becomes entrenched and debilitating, we could actually circumvent some of the problems we're going to see down the road. And unfortunately, we just can't pick up the kids when they're sub-threshold, but so we detect it, we notice it, but we don't do anything to remedy it. And we can't remedy it because we don't have the capacity to do it. The other thing that really causes me distress is that we know that, again, it's an unfair playing field. So for example, recent immigrants to Canada are less likely to access mental health care. So we have a problem. We have far too many children who have mental health issues, and we have far few services. We don't have enough services, pardon me. So these disturbing trends predate the pandemic. So what has happened during the pandemic? Are things better? Are things worse? And I'll just quickly check the chat to make sure nothing's coming up. Okay, nothing's good. Thanks for posting that, Stacey, appreciate it. Okay, so go like this. So since COVID-19, we documented what's happened since COVID-19 in the link that you now have. And I updated it again because the literature is changing weekly. It's amazing how many COVID studies are coming out. So I'm going to do my best to give you the most up-to-date snapshot of what's happening to children and youth. Before we get there, I need to highlight that there are a lot of problems with the current literature on COVID-19 and children's mental health. And one of the issues is that there's been such a need for rapid dissemination that the quality of the studies has not been there. We cannot use cross-sectional data to talk about change. The gold standard to assess true change, real change, is to use longitudinal studies, and ideally they would be population-based. And in the absence of that, we would use meta-analyses where they would collate all these effects into one effect, so we could appraise how well that relationship, how strong that relationship is. So keep in mind that there are a lot of studies out there, but there are a lot of poorly conducted studies. So we want studies that ideally have data before the pandemic and during the pandemic and are continuing to assess children over time. Now, we know that not everyone is suffering, but a lot are. And there's going to be differences. There's going to be differential exposure and vulnerability. Some children's parents lost their job. Some children lost their parents. Some children's schools were closed for more than other children. You know, the stresses are not equally distributed. So we're not going to expect all children to come out of this unscathed. One thing that's really bothering me is that we have told children and adults that kids are inherently resilient, and that's not true. Resilience has a lot to do with what supports you have in place, and some children have more supports than others. And if we go with that language about how resilience is just inherent in all children, we set them up for failure, because when they do not thrive, we say that like it implies that there's something wrong with them, right? That it's an entity. And so we really need to be careful about our resilience language, because one person could be resilient because of all of the assets they have in their life, and another will be less resilient because they have fewer assets. And the way people interpret the world is different and the like. So we're going to have differential exposure and vulnerability, and it's going to lead to differential outcomes. And I want to point out that not all kids are suffering as well. So one example is that children with social anxiety disorder have really had a hard time before the pandemic to make it to school. And now with the school closures and us having to go online and make sure that all kids were being educated, a group that has been largely ignored in terms of their educational needs are finally having their needs met. So there's going to be variability for sure. I'm going to start with eating disorders, and a lot of these data are longitudinal and some of them aren't, but there's enough evidence coming out to support that eating disorders is a particular problem with respect to the pandemic. So across Canada, children's hospitals experienced a 60% increase in admissions for eating disorders. In Ontario, our 5 children's hospitals were 223% above their capacity in June of 2021 because of disordered eating problems. In Western Australia, where this one's a longitudinal study, they have good pre-pandemic data, and during pandemic data, they saw a 104 increase in ER visits and admissions when they compared children from the beginning of the pandemic to the 3 previous years. Longitudinal studies consistently show increases in symptoms of anxiety and depression. So there are some longitudinal studies that are just during the period of the pandemic, and there are a lot of studies that actually predate the pandemic and continue on. So for example, we have data on anxiety and depression in our longitudinal study, and we have data from when they were 10 and they're now 24. So there are a lot of studies that were, took up this really quickly, recognized that we needed to collect data, and went ahead and did so. But there is definitely evidence supporting this change in symptoms of anxiety and depression. In terms of other disorders, not as much. Little bit of evidence on increased substance use, and a little bit of evidence on increase in externalizing problems, but a lot of evidence on symptoms of anxiety and depression. Population-based studies also support that youth are not faring well during the pandemic. So here's just one example. The Mental Health of Children and Young People study, which is a population-based study from the UK where they've been assessing children's mental health over time, found that the prevalence of mental health issues was 10.8% in 2017, and it increased to 16% in July 2020. And that adolescent girls were particularly impacted, where they saw this to be an issue in 27.2% of their participants. And what's interesting is most studies are showing that the anxiety problems and the issues with mood are affecting girls more than they are boys. The issue is that we have no Canadian population-based study. Now, I'm not saying that we don't have Canadian studies. I just mentioned we have a Canadian study, our group does, but we don't have any that actually look at all Canadians. So we have the CHEESY study, which we just received funding to look at a new wave for, but that was, based on a bunch of scientists getting together and reacting really quickly to this need. I've been on our Canadian government many times telling them that they need to invest in this type of study, because we don't know where to put our services then. We don't know how our children are doing. We don't know who was affected, how are they affected, for how long have they been affected. We need population-based studies. This meta-analysis came out recently. It was published in one of the flagship journals, JAMA Pediatrics, and they found that 1 in 4 youth experienced clinically elevated depression symptoms, and 1 in 5 experienced clinically elevated anxiety symptoms. Okay, so we had a problem with mental health issues before the pandemic, and things are getting worse during the pandemic. So, and we had no services before the pandemic. And now everybody's stretched, and medicine is stretched beyond capacity because of COVID cases. So this is not going to be a really good situation. I think you could see the writing on the wall. The other thing that is coming out of the literature is that at the beginning of the pandemic, we saw an elevation in symptoms. And so it seemed like, okay, things were going up, but they weren't going up too high. And yet, as we continue along this trajectory of time during the pandemic, the symptom counts are going through the roof. So, we need to do something to mitigate the risk to children and youth. So now I want to focus on why there's this impairment. And I think there are things that we can do to fix it. So I know I probably have everybody sad and worried, but there will be some silver linings to come, let's say. So there are many reasons why of this level of impairment. We don't have Canadian data, but this is so striking to me. We often don't think about parental death, but in this study that came out in JAMA, they looked at the estimated and projected parental death in the US from COVID, and they were striking. 17.5% to 20.2% increase in parental death due to COVID-19. So more children are bereaved than ever before. We also know that there have been increases in family violence and maltreatment. So the World Health Organization reported 10 to 50% increase in domestic violence helpline calls in some countries. There have been increases in child abuse related factors, but everybody's reporting this around the world, decreases in police reports and referrals to child protection services. So at a time when violence is going up, our reporting is going down. In one study, there was a 3.34% increase in foster care placements due to maltreatment. Rodriguez and I'll talk about this perfect storm, that child abuse is increasing because there's more parent-child conflict. They're in small spaces and they're spending more time together, and that's increasing their conflicts. That parents are experiencing many stressors like employment loss, food insecurity, and parents themselves are lonely, and all of these are contributing to this issue. But one of the things that causes me a lot of distress is the decline in reporting. And the main reason why we're seeing decline in reporting, even though the violence is going up, is because educators have long been the primary reporters of child abuse and neglect. So when children and youth are out of the preview of their teachers because of school closures, this safeguard is no longer in place for many vulnerable children. And I'll come back to this in a second. So the impairment is there because we see more stressors in children's lives. And remember, I said they lack autonomy. But we've also isolated children from their peers, from their teachers, from their extended family. In Ontario, as one example, we shut down everything in their lives for over 5 months. And this is in direct conflict with what we know about what it means to be human. Humans have a fundamental need to belong, and children are not exempt from this need. The priority of relationships is strong. We know that social ties are not just a luxury for children. They're essential for optimal development. And we know this from other studies of social deprivation. And we now know this again, unfortunately, because of COVID-19 and school closures. So what we have right now is a social deprivation natural experiment going on. And it's pointing to the same direction of what all our other studies have shown. You deprive children of their fundamental need to belong, and their development derails. So school closures has been something that I've been arguing against since the beginning of the pandemic. And it's interesting because my advocacy in this area has put me and my family at risk. People are annoyed with this idea that we keep schools open. Not all, of course. There have been a lot of people who've been on my side and recognize this. But, you know, I've been threatened. I've been told that I want to kill kids. I want to kill their grandparents, that I'm not taking everybody's welfare into consideration. And yet I am. I'm thinking about what I know from this literature. I've studied along, like Wendy, we've studied bullying for all of our adult lives. We know what happens when kids don't belong, when they're socially isolated from their peers. We know that the outcomes are not good. So what about school closures? So UNESCO has this really cool global monitoring website. So you can go on it and press on the region, and it will tell you what was closed, when was it closed, how long was it closed for. And using this global monitoring of school closures, we know that over 90% of the world's 1.6 billion students were impacted by school closures. We know that as of the summer, half of the world's students were still affected by partial or full school closures. I just spent a few weeks in Denmark, Norway, Finland, and Sweden, and I gave a number of talks. And it was really interesting because I asked them, because they all closed their schools as well, what did they think? Was that the right decision? And they all came back saying, no, it caused harm to the students in their country. And if they could do anything, like redo things, would be to try and keep them open as long as it was safe. Pre-COVID, we know that loneliness increased the risk of poor physical health, poor mental health, and lower academic achievement. And what we did when we closed schools is that we increased students So children and youth loneliness, we enormously increased it because they didn't have soccer practice anymore. They didn't go to gymnastics. They didn't go to school. They didn't get to see their friends. We kept them at home, and sometimes the home wasn't ideal. So I'll give you a few examples from around the world just on loneliness as one example. So, and these are good studies, which is why I'm highlighting them. So for example, for Belgian teens, loneliness had a greater negative impact on happiness than feelings of anxiety. So loneliness trumped anxiety. In a study of British teens, loneliness was associated with symptoms of mental health difficulties, which was more pronounced in teens who had poor relationships with their parents. So can you imagine, we take away your one source of resilience, your relationships with your peers, and we isolate you at home with people that you may not get along with well, or you have a fractured relationship with. For German children aged 9 to 18, the perceptions of social support was lower during the pandemic than before the pandemic, and this impacted their sense of well-being. So we know that loneliness is an issue. We know that it was an issue before the pandemic, and during the pandemic, kids became lonelier. The evidence is accumulating. So at first we were just thinking that, in a sense, they were correlational studies, and we couldn't directly pinpoint whether or not the school closures had an impact on social, emotional, and academic development. But the evidence is accumulating rapidly, and it's pointing to the fact that it did have a negative impact on virtually all aspects of child functioning. So I'll give you one example from academics. So in this study that was just released, they looked at district level schooling mode on test scores. So they compared in-person versus hybrid or distant learning. So in Ontario, we closed all schools, but across Canada, we didn't close all schools. So we can compare Ontario to BC or Quebec. I live 20 minutes away from the Quebec border, and what they did was very different from what we did. So again, there's this natural experiment that's happening. So they could do this, and they looked at it across 12 different states. And what they found was that pass rates declined compared to prior years. So kids were not passing their grades anymore. And that the declines were larger in districts with less in-person instruction. And this was moderated by things that we already know it would be moderated by: race and free and reduced price lunch eligibility. So meaning that the kids who were already disadvantaged became more disadvantaged during the pandemic in terms of academic achievement. And academic achievement doesn't sit in isolation, as you all know, right? So kids who do well academically tend to feel better about themselves. Higher self-esteem is a really good protector for anxiety and depression symptoms. So they're all inextricably related. So we could look at them in isolation, but they actually do not exist in isolation. So our first recommendation from the report that is hyperlinked now for all of you was that schools must be the first to open and the last to close. Obviously, if there's a safety issue and there's an outbreak in a school, I'm not suggesting that we keep them open and we endanger everybody in the community. But this blanket approach was never right. What we should have done was looked at the hot spots and closed based on hot spots instead of having all kids out of school. Recall that 90% of the world's 1.6 billion students were out of school because of COVID-19. Now, the thing about schools is that they're important, right? That they're not just about reading, writing, and arithmetic. They provide opportunities for learning and engaging in, sorry, I pressed a button, in the arts, the natural world, current events, sexual health, and digital literacies. We know that schools provide food resources for children and youth who are in need. They provide therapy for students with disability. They constitute a rich setting within which to develop social competencies. They can serve an important liaison function for families and community services. They're the first point of contact for children and youth with concerns related to mental health. They're the most common setting for mental health provisions. They're where we keep kids safe because educators are the primary reporters of child maltreatment. So we need schools to be open. We need kids to be under the preview of their teachers. And I don't want to just say that the issue is just school closures. Like, again, we took away everything from kids. We canceled all of their sports in Ontario, and I'm just using Ontario as an example. There are other areas in the country that this happened to also. And I wrote an op-ed about this, about how physical activity is a forgotten core element of child development. We shouldn't have done that either. And then this came out in the Globe and Mail that showed thousands of Canadian girls are not committed to playing sports post-COVID. But I knew this was going to happen because girls typically drop out of sports by around age 15. And those that are on the fence that we can keep in past that risk period, we can keep in for a lot longer. And the benefits of playing sports and exercising are enormous for mental health, for leadership skills, and the like. So it's not inconsequential closing schools and closing down children's activities. Okay, so how are we going to fix it? So we're going to spend the last little bit here, 15 minutes on fixing it, and then we'll engage in a fruitful discussion, I hope. So we argue that we need to create a national school-based mental health strategy. And this rubs some people wrong because they think, well, are we saying that teachers need to be therapists now because they do so much already? How can we actually expect them to do even more? That's not what we're saying. What we're saying is that we need these programs to be delivered in schools. And the reason being is that they are already established in their relationships. So teachers, administrators, and support staff have good relationships with children, youth, and their families. They're already connected within their communities. Schools also have the capacity to create awareness about mental health issues before they even become a problem. They can identify students who are at risk, and we talked about not just at risk for mental health issues, but also at risk for neglect and child maltreatment. They can provide prevention and early intervention services. So it'd be great if parents didn't have to leave work and pick up their child and bring them across town for a mental health appointment. That if we could just deliver it in schools where they already are, we would be in a better place. They can also, schools connect students with community services. So if we can't manage it in the schools, we can manage it in the community. So again, I'm not asking teachers to become mental health professionals. I'm asking our government to invest in a strategy, a national-based strategy where it's properly funded, where we have people like myself and Wendy in schools delivering these programs. The thing about schools is that they're already doing this without our help, and they're doing a good job at it, but they need a lot more help. As I said, we have far too many kids who have mental health difficulties. And as I mentioned previously, that schools are the first point of contact for students with mental health concerns. They're the ones who see it first. They are the most common setting for the provision of mental health services in Canada and elsewhere. Despite what people say, like a lot of people say, no, that's not true, but the evidence is there. We know from longitudinal studies, population-based studies, that this is indeed the case. Teachers are excellent at detecting when things are different from the norm. They care about the children. They know their community. They're excellent at flagging these children, and they are doing the services. Maybe not them directly, but services are being provided within schools. The other thing, and I'm sure Wendy will be on board with this recommendation, is that we need to invest in the social emotional development of children and youth through school-based social emotional learning approaches. So SEL programs are best practice programs. There is enough evidence to suggest that these types of programs, SEL programs, have a positive effect on children's mental health, on their social development, and on their academic capacity, that they should be implemented in all schools. It's interesting because when we wrote our report for the Royal Society of Canada, our equivalent, which is the National Academies of Science, Engineering, and Medicine in the United States, wrote their report. And we didn't share our report and they didn't share our report. They came out around the exact same time with the exact same recommendation. They said, independent of us, and we said, independent of them, that SEL is the way to go if we want to improve children's mental health and fix this enormous problem. Along this point with SEL is that we need youth in Canada to feel that they matter. They're facing so many unprecedented and prolonged stressors. They're living through a global pandemic. They need to know that they matter to us. So this is now more important than ever that they feel this. And it's interesting, again, independent of our equivalent to the United States, the National Academies of Science and Engineering and Medicine said the same thing. We said it in our report, they said it in their report. And I'll give you one example from our lab. So we looked at mattering across 4 different modalities of education. So in Ontario, when schools closed, even before they closed, there was always parent choice. So the parents could actually send their kids to school full-time if they were in elementary school, or they could be at home full-time. And secondary students could either be at home full-time, learning online, or they were in a hybrid model where they would go, let's say Monday, Wednesday, and Friday, and then alternate the next week with the other cohort. And we looked at mattering rates across these 4 different groups, deliveries of education. And what we found was that the kids who had more contact with their teacher, so the elementary school students who were in person full-time, felt like they mattered the most. And the secondary school kids or teens who learned at home alone felt like they mattered the least. And this is independent of a choice, because one could argue that, well, maybe they chose to go online because they didn't matter to begin with. So we did an experimental design. Sorry, I have a bit of a cough coming on. To correct for that, so there wasn't the selection effect, and we still found it to be true. Zoom is a poor substitution for in-person. If we were in person right now, I would have feedback from all of you. I have no idea if you're enjoying this. I don't see your eyes lighting up. I don't see you smiling. I don't see your head nods. I'm just taking it, I'm just taking a guess that you're enjoying it, but you may not be enjoying it. So we can't think that doing things away from actual face-to-face interactions is going to be good for children. And keep in mind, what happened with school closures is that everybody went online. So we know that they didn't feel like they mattered as much as when they were face-to-face. The evidence is really clear from the parenting literature that if you have high expectations and high caring, the best outcomes ensue. And now this is being borne out in education, where studies are looking at this combination of structure and support in looking at outcomes. And what they're finding is, just like with parenting, that teachers who have high expectations with support, appropriate support, have the best outcomes. So it's not just structure, so where you have high expectations with no caring, or just caring with no expectations that lead to the best outcomes. It's that combination of, I expect you to achieve this, and I care about you in your achievement of that goal. We need to also take steps to reduce inequity. And I know that's a huge, huge ask, but there are things that we can do, and there are things that our government can do quite readily. And recall that the risk is not equally shared. We know that children who live in poverty have far more mental health difficulties than those who come from more affluent families. So here's just one example. We wrote an op-ed and we put it in our report for the Royal Society of Canada, where we said that access to the internet should be free. It should be universal and it should be free. And we know that many kids did not have access to devices, did not have access to the internet. They couldn't even go to school when we closed the schools for them. And this shouldn't be the case. There are countries who've had free access to broadband since 2008. So I think Canada, should lead in this endeavor. And that's just one example where we can level the playing field. We also need to invest in a comprehensive population-based follow-up study. I don't know how we make decisions about services when we don't know what we're doing. We're shooting in the dark. And we were really ill prepared for this pandemic. And it would be a huge missed opportunity if we didn't invest in, for example, the CHEESY study. We really need to know what's happened to Canadian students, all Canadian students. And again, so we wrote an op-ed hoping to put pressure on the government. I don't know if the government likes me anymore, but we can have a discussion about that too. We also argued that we need to prioritize recess and other forms of breaks. So what happened again during COVID, we were so afraid about the spreading of the virus that we took away their one great moment of the day, right? So recess isn't great if you're being bullied. So I'm not going to say it's the great moment for all kids, but it's a time when kids learn to negotiate. It's a time when they learn to self-regulate. It's a time when they get to unwind and have fun and be kids and try things out. Recess is a really important part of the day for learning. And what we did was we cut it out. We had them sit at their desk, eat their lunch quickly, go outside, put them into little squares and said, you can only interact with these kids. We took away this one part. So we sent them to school, which was great. At least they were in school. And then we took away a really important part of the day, thinking that recess is not important. Recess and other forms of breaks are important to children and to teens. And we need to be considering this as an essential part of the day and not do this anymore. We also need schools to have equipment that's appropriate space for learning and socializing outdoors. And that there's another equity issue here. Some schools have these amazing schoolyards and others are just cement, barren cement. And that shouldn't be the case. When we talk about education being one of the areas where equity should not be an issue, we tend to ignore it when it comes to the playground. So we also wrote something about this, arguing why recess is more important than ever. And finally, we need to be vigilant. So we may be on our way out of a pandemic, although this new variant will prove to be interesting. We are going to be going to an endemic. We're never going to get rid of COVID. So how do we manage that? And I think we need to think about this now instead of react to it when it happens, because we already saw the damage that happens to kids when we react slowly. We told children for the better part of 2 years that the pandemic is scary and that people could die, and we closed schools on them and we took them away from their soccer practices and their Girl Guide meetings and the like. And now it's going to be something that's with us forever. And how are we going to manage their fear? How are we going to manage their tolerance for an outbreak of COVID-19 5 years from now in their school? So we need to be thinking about how the endemic is going to look and how we can make sure children and youth are happy and protected. So in sum, here's what I think we could do or should do to improve children's mental health. So I think we need to, first of all, focus on their fundamental need to belong. This is what makes us human. We're biologically based to form connections with others. We always need to keep this in mind when we make decisions about children and youth. We need to prioritize social emotional learning and development. I think that this should be in every school, every classroom. It should be part of the core curriculum. We need to deliver our programs, our mental health programs, where kids are and they're at school. I really think that this should be school-based mental health. And we need to keep schools open as long as it's safe. So no more blanket approaches of closing down all schools. We need to never do this again. And we need to focus on healthy relationships. And this is what PREVNet's core value is. Focusing on healthy relationships is one of the best ways to promote healthy development for youth. And that's that. So I look forward to our discussion.
Thank you, Tracy.
Thank you.
I want you to know I was smiling and nodding the whole time. Just
Okay, good. I appreciate that. I felt the energy.
I didn't want to distract, well, you know, when you were on and leave my camera on.
It's okay. I looked at myself the whole time and I was nodding and approving my own self there. So it's okay.
That was amazing talk. It was a great summary of where we're at and what we've been through and a lot of solutions. And I think that's really important to have. So I'm going to there's one question for you in the chat.
So I have Karina, one of my previous master's students. Hi, Karina, how are you doing? Currently working at the University Council, so notice students' disappointment in virtual learning in the university. Would you predict that the results would be the same for university students? Yes, absolutely, Karina. So we know this, Gordon Flett's done a little bit of work on mattering in university students, and what he found and his group found was that same thing, that they felt like they mattered more when they were in person than when we went remote. So, you know, we're talking about children and youth today, but we can apply this to young adults at university. We need to keep universities open as well.
Okay, they're coming in now at a rate.
And then Katie is asking, when you talk about school-based mental health, what do you think that could look like? I worked with high school students for years and have often heard about how school counselors are not as effective as they could be. Do you see solutions? Have actual wellness clinics in schools with mental health and so complicated question, but basically what I see is that we would have, you know, universal programs to help with mental health. So for example, that we know that there's a really good grade 5 program that helps with prevention program for depression. So things like that. So we could apply these programs in schools at the universal level. We could start talking about mental health earlier. And when kids are detected, then we would have a more targeted approach. So universal with targeted approaches is exactly what we do with bullying, right, Wendy? So we come in and we do these programs so that we can reduce bullying across the whole population, but we recognize it's not going to meet everybody's needs. And when their needs are not met, then we do more targeted interventions with those individuals. And I would love to see this delivered at school. And we would have to be clever about how that would be delivered. There are places that do this, right? We got rid of the school nurse. So if we had that old program that we used to have, then that could be delivered not necessarily by a nurse, but just, you know, where we had health being managed within schools. But mostly what I'm thinking about is SEL would be part of this. So SEL would be part of our mental health framework. We would use best practice intervention and prevention programs within schools, and then we would manage kids who have more significant needs either within schools or refer them back out to the community to be managed that way. And then we have something that's kind of like when creating tier 1 healthy school programs, where do you suggest educators start? So this is why I want this to be a national program. I don't think it's like teachers should be doing this, and it's not because they don't have the capacity. It's because it's something that we should be doing as a national platform to better all kids across Canada. One of the issues with health and education, as you know, is at the provincial territorial level. So we have all these different ways of doing things. Although when it comes to core curriculum, it's pretty standard. I'd love for mental health and social emotional learning to be that standardized, like that it would be like the curriculum for teaching mathematics. So I would think that people like social workers, school counselors, psychologists, and educators, they shouldn't be excluded from this conversation where we develop something. And it wouldn't be developing it from scratch because it exists in many other countries. It's not like this is not something that's done. Finland does this. The UK does this. There are many, many programs that exist, and there's certain states in the United States that do it, and there's certain school boards that are already doing it. So we definitely have the capacity to do it in Canada. Okay, and then I'm just managing it all myself, right? Or when
I know, I popped up to be helpful, but I'm letting it go.
I just assumed it was me, so I'll just continue on. Are the studies on the impact of social media perhaps being even stronger effect during the pandemic, especially for girls? Yes, so what the studies show is that when kids were isolated from their peers, and especially girls, a lot of them turned to social media and to other forms of communication, like text-based communication with their friends. And that actually put them at greater risk for depression and anxiety. So those that were the heaviest users of social media and text-based communication, especially for adolescent girls, were the ones who ended up with more depression and more anxiety. So social media use was a really important factor because it proved to be a poor substitution for in-person relationships. Okay, I'll let you take over now, Wendy, because I just,
All right. Well, Krista says, is mental health a federal or provincial mandate? How do you see getting the provinces on board?
Well, we would have to engage across sectors, right? So we would have to get health on board and connecting with education. And then we would have federal funding also infused within this. I don't like how the federal government pulls itself out, right? Like, how all the envelope comes from the province for education for the most part. I think that when you have something like mental health difficulties affecting 20% of your population, your youth population, it behooves the federal government to step in and do something about it. And so I would love to see them also funding these platforms. They do some funding, right? Like we do know that we have mental health programs that are directly funded from the federal government, right, Wendy? Like these exist, but what I want is more on the ground frontline service providers getting funding for those individuals. So not where the government will fund a website for us to go to. I want actually people in schools helping kids. I know it sounds big, and maybe I'm manic and I'm missing the boat on this and thinking it's going to happen, but I'm going to work hard for it to happen in my lifetime. And I'm going to get Wendy to help me with it.
But I think this is the time. I think in times like this, it's an opportunity to transform. And I think like it is big, but this is a window of opportunity. Like that's my spin.
I'm glad you said that, Wendy, because more than ever, we see headlines now in the media about mental health being a crisis in children. How long have you and I been screaming about this issue, right? It's not like it just emerged today, which is why the talk was structured the way it was. We started with what it looked like before the pandemic. What does it look like now? I like that that's in the media because it puts pressure on the government. The reason I kept showing you these op-eds is because I wanted to show you that we have sustained pressure on the government. I've had the privilege of speaking with Mona Niemer several times, who's the chief scientist for Canada. And when I speak with Mona, I tell her this all the time. This is what we need to do. This is how we can fix it. This is what we need to do to move forward and help children and youth in Canada. So if we all did it, right, and we kept with the same message, echoing the same message, something's going to be done because, politicians are sensitive to the will of voters. And if the will of voters says we're not tolerating this anymore, then we'll see change.
I'm going to bring you back to some questions.
Yeah, please do.
Lisa Wolf says, thank you for the excellent presentation. There's been some indication that some children have experienced a reprieve from school-related bullying during school closure. Any evidence of this, and is it a short-term effect while schools were closed? Does it store up social coping problems?
So it's funny that you're asking that because we actually did the study on this. We did an experimental study. It was published in Aggressive Behavior, I think in January, where we showed a reduction in bullying that I've never seen in my lifetime. It was almost half the reduction in bullying when kids were, and they weren't at home. It wasn't when schools were closed. It was during the pandemic. And what I think has happened is that we put so much energy to supervising the application of infectious disease prevention controls that we inadvertently also supervise their peer interactions. And Wendy could say the same thing as I'll say right now. We know from the literature that increasing supervision does reduce bullying. So I think that there was this unintended positive effect of this supervision on bullying rates. And I was just in Finland, and Christina Salmon-Valley's group found the same thing for all of Finland, right? They have longitudinal data. They've never seen reductions like this. And I know of an Italian group that just found the same thing. So these two are papers or studies are under review. Now, if it is indeed because of student supervision and we reduced it by 50% bullying, what do? Right? Like, if we don't then act on that and we don't increase supervision, I think that that's negligent. What do you think, Wendy?
I agree fully. I totally agree. Like, we know what works now potentially from this natural experiment.
Exactly. Yes. So let's do it. Let's make sure that this gets in place.
Okay. There's another question about, I'm a high school teacher, teaching virtually with at-risk students, and yes, some are flourishing. Currently in my school board, the schools have a choice of virtual versus in school. And I wonder if that is something that you would recommend continuing, a virtual school for students who want it.
I think that the pandemic forced innovation on education that was not going to happen. Education is really traditional and really entrenched. And it's really hard to then mess with that formula, because if you get it wrong, you're going to be in real trouble. But the pandemic forced us to do things that we weren't going to do otherwise. And it forced us to think about alternative ways of delivering the curriculum to students who can't manage to get to school. So I do think that we should retain this. Now, the challenge is that I talked about that intolerance for discomfort. Because what I don't want us to do is to have kids, let's say with social anxiety disorder, as just one example, learn everything online and never get challenged. And then that becomes, again, entrenched, for lack of a better word that I keep repeating, but it does become entrenched. And now you have somebody who has agoraphobia on top of that and is not now able to come out into society. So we have to be really, we have to be thoughtful about how we're going to do this. But one thing is that the school has not always been the best environment for all students. And this really forced us to look at that. And Wendy and I know this intimately because we study bullying. So we know that the kids that we study don't like going to school. School's a horrible place for them. They're ruthlessly attacked and belittled and humiliated on a daily basis. So, I do think that we have to keep all these things in mind. But that said, I do think that there's going to be some really good things that are going to come out of this that we wouldn't have been able to budge if it were not for the pandemic.
I agree, but I'm going to say, I think the challenge is it's not a one size fits all, right? We have to match it. And so how do we ensure that the lessons that we have learned, like the ones that you've talked about so eloquently today, are now implemented? Do you know what I mean? This isn't just what we understood in COVID, but this is something that we've now learned and we can change to make lives better for kids in the future. So what do you see as like the next two things we should do?
Well, okay, so it's funny because when you say that, my heart rate goes up a little bit, because I think, how will we ever know if we don't measure it at the same time, right? So whatever we do, we have to measure it to make sure, because we're going to use this point in time to make hypotheses about what worked, but we'll never know because there'll never be an experimental design. So, but it can point us into a direction that we wouldn't have gone to begin with, right? So again, back to what have we been screaming about? I've been screaming about increased supervision. Every time I give a school talk on bullying, I talk about supervision, increase supervision to reduce bullying. So then we need to then test that out to see, was that really what happened? Is that really why bullying went down around the world during the pandemic? In terms of what we're going to see moving forward is, I think we need to think about heterogeneity, and we haven't thought about heterogeneity. We've really thought about learners as being homogeneous. And I'm not saying I know educators recognize that and stuff, but the way we deliver programs is that here's the program and we expect kids to fit into this program. And now I think we're going to be thinking about program delivery that's more student-centered, if that makes sense.
Yeah, and student-centered and adapted for different communities,
exactly,
and cultures, but evaluated. Absolutely. Evaluate to make sure we're doing no harm. That
exactly, because
problem.
Yeah, we don't know. We won't know unless we test it out.
It's a question. Sorry, I found another question. It's from Joanne. We have been offering Lions Quest SEL programs to schools/educators across the country, often at no cost, thanks to the Lions Club. We are getting pushback from educators. We don't have time. We're too overwhelmed. We need to catch up on academics. What are the key messages that we can use to demonstrate that kids can't wait?
It's such a great question. And we actually anticipated that in our report, because what we said is that, and I've already seen it come to fruition. What I didn't want were kids to go back to school in September and for teachers to feel the pressure of getting them caught up. So, how I had that slide on learning loss, I was actually debating whether or not that was going to be appropriate to put in, because I don't want people to think that we need to get caught up on reading and writing and arithmetic at the expense of social emotional development. I think that we need to do a better job generally in our pre-education programs of having the next generation of teachers come out, educators come out, recognizing that learning is socially mediated, that there is no learning when you don't feel like you belong, when you don't feel like you matter, when you don't think that you're worthy. When you look at SEL programs, so the Taylor et al. Meta-analysis that's in child development in 2017 that showed that social emotional programs, guess what? Learning programs have an enormous impact on academic achievement. So I love that you have these programs, and I think that we need to do a better job at selling why this is important, how the bottom line actually improves, academic achievement improves when you focus on social emotional development. And part of that is also taking pressure off of educators from parents. So parents, we're a little bit misguided on what we think is important for our students, like for our children. If we could just calm down a little bit and take a step back and not be in a race to get nowhere. So when we think about Finland, they teach their kids how to read a whole year after we teach our kids how to read. And they're ranked higher than us on the PISA data set for literacy. So we don't know what the sensitive periods are for learning things, but we do know that from a lot of the Scandinavian countries and Finland, which is not Scandinavian, of course, but we do know from those Northern European countries who invest heavily in early childhood education and social emotional learning and are at the top of the distribution on academic achievement around the world, that's the way to go.
Yeah, kids can't learn if they're not well.
No, they can't.
And if they don't have healthy relationships. So
no,
I think that's
and let's
really
face
important
it,
point.
Winnie, kids go to school to be with their friends, and then we sprinkle math on top of it, right? Their fundamental need is first to belong.
And so I think that's a great end message.
I like that.
Cannot thank you enough. This was a packed talk with lots of information. You unpacked it in a way that we could all understand it. And it also challenged us to think about how we do our practice, how we evaluate our practice, and how we ensure that we're doing is having the positive effects, and where to focus our energy and our time. So I thank you for that. And to the people that came and listened and participated, thank you for your thoughtful questions and your engagement. Has Stacy's put in the box for our feedback, so please don't forget to do that, because that will help us moving forward. And yeah, kids can't wait. Let's get going and support our kids, and let's make some noise to bring change. Thanks,
you.
Tracy.
And thanks, everybody. I appreciate the questions and your moderating. I'm so glad I let you moderate the last part of it, Wendy.
I earned my keep.
Yeah, I'm really glad I let you do it.
Okay, thanks everyone. Take care.
Thanks.
Bye.